manual cervical traction. There are multiple ways to do this, so there's not only one correct way, but a fairly easy way to do it is to have the belt wrapped around you and around your scapula so that you have some tension, but your arms are not fully extended to get that tension. Because what's going to happen is, as I have my hands like this, I'm going to have Jason's neck in my hands, and then I want to just be able to lean back. So I don't want my arms to do all the work. So I'm just going to use the belt to help give me a force when I'm holding his head like this and I'm leaning back. I have the adjustment strap there right where I can reach it so that I can adjust it as needed, and I have the table height adjusting right here as well. So one of the things to remember is that they're going to have arm pain for doing this. This is for somebody that has a radiculopathy, arm pain symptoms. So we don't want them lifting their head by themselves because that will put a lot of compressive load through the muscle contraction. So what I'm going to do is sort of maintain this position with my left hand here, and I'm going to reach around and say, okay, Jason, don't lift your head, let me lift it up. So I'm going to lift it up and slide my hand underneath, and then I'm going to slide my right hand under. Now I have my hands crossed under here so that I have a really good grip on Jason's neck. My thenar eminences are at his occipital condyles, so that as I hold here, I don't actually have to squeeze or do anything with my hands. I just lean back. Can you feel pull on that, Jason? And I would adjust to how much pull the patient tolerates, how much he wants, whether or not it's changing the arm symptoms. So I would then be like, okay, sort of tell me what's happening to your arm. As we're doing this, again, we'd hope for centralization or minimizing of the symptoms. And we can hold it in a variety of ways. We can hold 30 seconds on and then just let up a little bit of the tension without letting the belt go slack and changing your whole position around. And then I can lean on again and adjust how much tension that I'm putting based on the patient's symptoms. Hold again for 30 seconds, say, and then let up for 10 seconds or more. So that is just intermittent so that we can be on and off. The parameters are really not well known, how long you will pull. So you really just want to talk to the patient and make sure that as you're applying this pressure, that the symptoms are still responding in a positive way. And I always tell people, like, if it starts to aggravate again after a while, let us know, because we don't want to have the symptoms respond and then come back again.